In the NEET super specialty exam held in India every year, surgical oncology is one of the most sought after branches. But how competitive is it? Should you put in time to study for surgical oncology, or will it be a waste of time and effort? One might have responsibilities, might have to work and study on the side, while the other person may have the luxury to study full time. So let's check out the competitive level of surgical oncology. We'll analyze the result of NEET Super Specialty Exam 2019 for this branch surgical oncology and see how many people have applied for it, what was the score of rank 1, and what is the score of rank 100, rank 200, and all, so that you can get a slight idea of what the competitive level is and whether and decide whether you want to go for it or not. It's important to understand how competitive one subject is and then apply for it, because you can choose only two specialty. If you choose the most competitive specialties in which around 2000 to 3000 people are applying and you're not studying much, maybe your effort will go to waste. So you need to understand very well how competitive it is, how much time you can give to your studies, and see whether you'll be able to score that much. So if you go to the MCI website for college and courses, type in MCI courses in Google search, and the first result that comes out there, click on it, and this website will open up. There we can choose surgical oncology MCH and choose all states. It will show a result of 31 colleges offering 158 seats. These are all MCH seats. This includes AIMS, JIPMER, and PGI, but these colleges are not included in NEET-SS Super Specialty exam. The exam is for 400 marks. There are 100 questions, and each question carries 4 marks if you get it correct. 60 questions are specialty based, that is on surgical oncology, and 40 questions will be on general surgery topics. So the person who got first position in 2019 for surgical oncology had a score of 353. Rank 2 had a score of 346. Rank 3 had a score of 342. Rank 4 had a score of 337. Rank 5 had a score of 330. So you can see how competitive this is. In plastic surgery, the first rank had a score of below 300. Over here, the first 5 ranks have 330 or above. You can see that rank 10 has got a score of 324. Rank 20 had got a score of 320. Rank 30 had got a score of 315. Rank 40 had a score of 312. Rank 50 had a score of 311, and so on. Even the person who got rank 100 in this exam got a score of 300. That's quite a lot. That's 75% score to attain a rank of 100. Then the person who got a rank of 200 had a score of 286. The person who got rank 500 has a score of 256. Just for comparison, a person who had a score of 257 in plastic surgery had rank 10. So this is the difference in competitive level of plastic surgery and surgical oncology. You get a score of 256 and your rank is around 500. I mean, it's not going to be the same every year. There'll be different scores every year, but this is how many people are studying for it, how seriously they are studying for it, and how many people are competing for it. A total of 1,844 candidates applied for surgical oncology in 2019. The person who got the last rank had a score of 16. So if you manage to get more than 16, you won't be qualified, obviously, because the qualifying mark is 50th percentile, but at least you won't be the last rank holder. Let's see the 50% mark. A score of 200. The rank of that candidate was 1,200. So see, if in your practice exams, if you're getting 50% questions correct, there's nothing to be happy about in terms of surgical oncology, because your rank will be around 1,000 or more. Even if you get 250, it's nothing great. You probably won't get a seat for surgical oncology. So that's it, guys. Surgical oncology is a very competitive branch. Getting jobs are easier. The practice is much easier after completing MCH. So a lot of people are studying for it seriously, and to get a very good rank, you need a very high score. So it's very competitive, just like surgical gastroenterology and urology. You really need to focus and study for this. It might take a year or two. I've heard of people who studied for 4 months and got a very good rank, like uh, somewhere around 10 or 20 by studying just 4 months. So it depends on your knowledge, your determination, how many hours you can put. If you are just studying for a couple of hours on the side, you have a very hectic duty, and you study for a year, I don't think it's possible to crack this exam. You might be lucky. I'm not saying you can't, but it is competitive. It needs hard work and dedication for this branch. Thanks for watching. Please like the video and subscribe.